things you should know about diabetes insipidus. Have you ever heard about diabetes insipidus? Well, it is a common condition in which your kidneys cannot prevent the excretion of water. We always have heard about diabetes mellitus. However, they are not related to each other. It is because when we say diabetes mellitus, it involves high blood sugar levels that is not used for energy. But when someone has diabetes insipidus, they have normal blood sugar, but their kidneys cannot balance the fluid in the body. First thing we should know about diabetes insipidus are its causes. Diabetes insipidus are classified into two. First is, diabetes insipidus is due to the lack of antidiuretic hormone or the ADH, which is categorized as cranial diabetes insipidus. It is when the hypothalamus does not produce ADH for the pituitary gland to secrete. It can be idiopathic without a clear cause or can be caused by brain tumors, head injury, brain malformations, brain infections, or even brain surgery or radiotherapy. The second one is the lack of response to the ADH, which is classified as the nephrogenic diabetes insipidus. It is when the collecting ducts of the kidneys do not respond to the ADH. It can be also caused by drugs, particularly lithium, intrinsic kidney diseases, and electrolyte disturbances. The hyposecretion of antidiuretic hormone and the lack of response to it prevents the kidneys from being able to concentrate the urine, leading to polyuria or the excessive amounts of urine and polydipsia or excessive thirst. Second thing we must know about diabetes insipidus are its symptoms. A person with diabetes insipidus may experience being extremely thirsty, producing large amounts of pale urine, frequently needing to get up to urinate during the night, and preferring cold drinks. Number 3. How is it diagnosed? Well, the healthcare provider will ask you about your medical history and symptoms. Tests that may be ordered include blood sodium and osmolarity, desmopressin challenge, MRI of the head, urinalysis, urine concentration, and urine output. The simple excessive amounts of urine may lead to number 4. Complications. Insipidus may lead to dehydration. Dehydration can cause dry mouth, changes in skin density, thirst, and fatigue. Another one is electrolyte imbalance. Diabetes insipidus can cause an imbalance in the minerals in your blood, such as sodium and potassium, that maintain the fluid balance in your body. Symptoms of an electrolyte imbalance may include weakness, nausea, vomiting, loss of appetite, muscle cramps, and confusion. There's no such cure in diabetes insipidus. That's why, and number 5, let's talk about its treatments. First is the use of vasopressin, a synthetic antidiuretic hormone. It is given either as a nasal spray, tablets, or injections. This controls the urine output and fluid balance and prevents dehydration. However, when it's in a mild case, drinking more water may be all that is needed. If the body's thirst control is not working, for example, the hypothalamus is damaged, a prescription for a certain amount of water intake may be also needed to ensure proper rehydration.